2016 Second Extraordinary Session Public Health and Developmental Services Committee. We have 6 items to be heard. The only non-member is from the committee, that is Senator Liu, so we'll allow her to go first. That's item number 4, SB X28. We have not established a quorum as of yet, but upon doing so, we will interrupt and then establish a quorum. But good afternoon, Senator, and please proceed.
Thank you very much. Good afternoon, members. This bill requires all school districts and charter schools to adopt a tobacco-free campus policy. Under current law, the California Department of Education provides grants for an anti-tobacco education programs to reduce the number of pupils who begin to use tobacco or continue to use tobacco. California voters in 1988 passed Proposition 99, which increased the tax on each pack of cigarettes by 25 cents. The Annual Budget Act appropriates these funds for several purposes, including the Tobacco Use Prevention and Education Program in schools. School districts that receive these competitive grants must develop policies to ban any and all tobacco use on school property, and they must post, quote, tobacco use is prohibited signs. According to CDE, all 58 of the county offices of education and over 75% of school districts are certified tobacco-free. With more than half of California schools now 100% tobacco-free, the legislature should make it clear this should become a standard for all schools, including charter schools. This bill requires all public school districts and charter schools to develop a tobacco ban policy and post signs at the entrance to school grounds, regardless of whether the school receives Prop 98 funding. This bill adds language to the Health and Safety Code to expand the definition of tobacco products to include electronic cigarettes, vaping devices, snuff, chew, and other forms of smokeless tobacco. A tobacco-free school district policy often gives school employees the added motivation needed to cut down tobacco use or quit altogether, and I ask for your aye vote.
Thank you. Before we get started, just let me remind everybody that we are going to be allowing a total of 6 minutes, 2 minutes per presenter, so I have up to 3 presenters, or if you choose to have one individual do all 6 minutes. After that, for support and opposition, and after that, we're going to just ask for name and position only. Anyone would like to speak in support, please proceed.
My name is Kula Koenig, Government Relations Director with the American Heart Association and American Stroke Association. The mission of the American Heart Association is to build lives free of cardiovascular disease and stroke. We know that smoking increases the risk of heart disease and stroke by 2 to 4 times, and fully support this legislation, which seeks to provide a tobacco-free...
If you don't mind, I'm going to interrupt you just for a second. We have a quorum. I want to make sure we don't lose it. Would you call the roll, please? Would you pause the... and we'll pause the time.
Hernandez?
Here.
Hernandez here. Morel? Anderson? Bell? Hall? Hall here. Leno? Here. McGuire? Mitchell? Monning? Monning here. Morlock? Morlock here. Nielsen? Nielsen here. Pan? Wolk? Wolk here.
So quorum has been established. I apologize. Please proceed.
In California, we have over 20,000 kids under the age of 18 who become new smokers each year. 45.4 million. That is a pack of cigarettes bought or smoked by kids each year. Even if students themselves are not using tobacco, teachers and staff who do so on campus send a message to students that this behavior is without risk. We need to ensure that our kids are not also exposed to secondhand smoke, as almost 1/3 of deaths from coronary heart disease are attributable to smoking and secondhand smoke. Coupled with the enormous healthcare costs associated with smoking that you will hear from other testimonies today, we think that it's important for schools to implement 100% tobacco-free policies, regardless of whether they receive tobacco use and prevention education funding. According to the Surgeon General, evidence shows that comprehensive school-based programs that include tobacco-free policies, combined with community mass media efforts, can effectively prevent or postpone the onset of smoking by 20 to 40% among U.S. teens. A tobacco-free schools district policy makes schools and our kids healthier. I ask for your aye vote.
Thank you. Please proceed.
Alicia Sanchez, representing the California Medical Association and our over 40,000 members. We have longstanding policies supporting efforts to remove tobacco products and their use from schools. And it's interesting in talking with people about this bill, they're shocked to learn that there is not already a requirement that schools be tobacco-free. So it makes sense in the public's mind, it makes sense for health reasons, and schools are the place where we should be modeling healthy policy. Consistently, when we talk about tobacco control, we hear a refrain of education, providing education to people to ensure that they know the risks associated with tobacco use, and this is an important way and an important step to achieve that. Thank you.
Thank you. Anyone else in support?
Lydia Bourne, representing American Academy of Pediatrics. According to AAP, we have longstanding policies relating to smoke-free environments, not only in schools. We also look at, the AAP also looks at tobacco as a pediatric disease because of the long-lasting effects, not only from secondhand smoke, but from third-hand smoke. And so with these policies making schools tobacco-free and smoke-free, we are clearly in support.
Good afternoon, Mr. Chair and members. Sawait Sium on behalf of Health Access California, and we are in support.
Thank you. Anyone else in support? Name and position only.
David Ford on behalf of the Association of Northern California Oncologists and the Medical Oncology Association of Southern California in support.
Kimberly Chen with the California Pan-Ethnic Health Network in support.
Jasmine Gordon on behalf of the California Black Health Network in support.
Jerry Jeffy, California Chronic Care Coalition in support.
Autumn Ogden with the American Cancer Society Cancer Action Network also in support.
Chair and members, Sean South with the California Primary Care Association in support.
Judith Riegel with the County Health Executives Association in support.
Lindsay Freitas with the American Lung Association in California in strong support.
Robert Harris on behalf of the California Society of Addiction Medicine in support.
Erin Gable on behalf of First Five California. We do not yet have a position on the bill, but are in support of the comprehensive tobacco strategies, control strategies in this bill. Thank you.
Megan Allred on behalf of the California Dental Association in support.
Terry Brennan on behalf of SEIU California in support.
Justin Gare with the March of Dimes in support.
Karen Ling with the Solano County Board of Supervisors in support.
Alexis Fernandez on behalf of the First Five Association, representing the 58 commissions in support.
Dr. Donald Lyman from the Academy of Preventive Medicine in support.
Thank you. Is there any opposition? Questions, comments from any of the members? Senator Morlock?
Mr. Chair, I just want to confirm this is not during business hours. This is 24 hours. And that this is not optional. This is mandatory for every school district in the state.
And would you like to? Yes.
Yes.
Okay. Thank you.
We have seen no other questions. We have a motion by Senator Woke. Would you like to close?
I simply ask for your aye vote.
Thank you. We have and there are some amendments that are going to be taken in appropriations.
Yes.
Is that correct?
Yes.
Okay. So this is SB 8X2 due pass 2 appropriations. Call the members, please.
Hernandez.
Aye.
Hernandez, aye. Morel. Morel. No. Morel, no. Anderson. Bell. Hall.
Yes.
Hall, aye. Leno.
Yes.
Leno, aye. McGuire. McGuire, aye. Mitchell. Monning. Monning, aye. Morlock. Morlock, no. Nielsen. Nielsen, no. Pan.
Aye.
Pan, aye. Wolk. Wolk, aye.
Thank you, members.
That currently has 7, enough to get out, but we're going to leave that bill on call. We have a few absent members. We're going to now move on to item number 1, SBX 25. Leno, electronic cigarettes. Good afternoon, Senator.
Good afternoon, Mr. Chair and committee members. Thank you for the opportunity to allow me to present this bill in special session. And the reason it is here in Health Committee is because it deals with a health crisis, a growing health crisis. And before I begin, I just want to thank, and I'll amend the list, so I'll be leaving some folks out, but all of the leading health advocates in the state of California are listed in support of this bill, including our sponsors, the American Cancer Society, Cancer Action Network, the American Heart Association, American Stroke Association, American Lung Association, as well as the Association of Northern California Oncologists, Breathe California, California Black Health Network, California Dental Association, California Medical Association, California Pan-Ethnic Health Network, California Primary Care Association, California Society for Addiction Medicine, Common Sense Kids Action, First Five Association, Kaiser Permanente. We're very pleased to have our Attorney General Kamala Harris now in support of the bill, along with the California Narcotics Officers Association, the Police Chiefs Association, California State Association of Counties, and that's about half the list of all those who have come together to support this bill, which very simply will define e-cigarettes as suggested by pending rules at the Food and Drug Administration in Washington to define e-cigarettes as a tobacco product. As such, with that in statute, it would fall under our California smoke-free laws, which means places where smoking traditional cigarettes is prohibited would be the same for e-cigarettes, as well as having e-cigarettes fall under our STAKE Act, which is the Stop Tobacco Access to Kids Enforcement Act. That's what the bill does. Additionally, it will require child-resistant caps on these liquids, and I want to thank the committee for making the suggested amendment on page 25, line 5, to change the wording from child-proof to child-resistant. I think that's a good idea, and we're happy to take that as an amendment. So the bill has been heard in any number of committees already, so I know many of you are familiar with it. But to get to the core question as to why should e-cigarettes be considered and be defined as tobacco products is pretty straightforward. It currently falls under the federal definition of tobacco products. The federal definition is the term tobacco product means any product made or derived from tobacco that is intended for human consumption, including any component, part, or accessory of a tobacco plant. So that's the federal definition. The nicotine that is in e-cigarettes is derived from the tobacco plant. There's no place else on earth you get nicotine but from tobacco. It is a tobacco product. Beyond that, and you can't make this stuff up, but I'll share you a wonderful little story. One of the major players in the industry called Enjoy, at a time before Congress authorized the Food and Drug Administration to be able to regulate tobacco products. At the time, they could only regulate cessation devices. Enjoy sued the Food and Drug Administration, claiming they were a tobacco product. They were not a cessation device, because if they were a cessation device, then FDA could regulate them. They went to court. The judge ruled in Enjoy's favor. And I'll read you the quote from the judge in his opinion. Quote, "The firm claims that its electronic cigarettes use a liquid nicotine mixture derived from tobacco and that its products are not marketed for therapeutic uses. So the court ruled, yes, you were right, Enjoy. You are a tobacco product. You are not a cessation device. Now, of course, it's more convenient to be a cessation device, not a tobacco product. Clearly, you can't have it both ways. Just saying that something is a cessation device doesn't make it a cessation device. There are clinical tests that must be held. You must apply to the FDA to become a cessation device. And to date, This industry, which has grown from $1 billion in revenue just a few years ago to $2.5 billion a year ago to $3.5 this year, they have not yet taken the time or trouble to go to the FDA to apply to be determined to be a cessation device. Bless their hearts if they want to do so. I'm not here to say that it's not. But if they were to, and should they be determined to be a cessation device, then this bill will not impact them because this bill just deals with tobacco products. But it gets even better. I can show you some information from the industry's own websites. This product is called Mark 10, and it is an e-cigarette product. Under ingredients, it says tobacco-derived nicotine, and then it has a warning on it, and this is done by, not by dictative law, but proactively. The warning on the Mark 10 package says, this product is not a smoking cessation product and has not been tested as such. Then it goes on to say, California Proposition 65 warning, this product contains nicotine, a chemical known to the state of California to cause birth defects and other reproductive harm. But that's not the only one. Vapor, which is an R.J. Reynolds product, calls itself an innovative digital tobacco product. You can go to their website. It's right there. They call themselves an innovative digital tobacco product. They go on to say that they heat liquid containing nicotine derived from tobacco. It goes on to say that this product is a tobacco product under federal law. And then just one more. As the industry continues to grow, and as has already been noted in any number of studies in the past couple of years, the nicotine content in e-cigarettes is more than doubled. And now the next step is Philip Morris debuts an e-cigarette with real tobacco. So it would seem rather clear that this is a tobacco product. Now, what motivates me so is that the fastest growing market segment of this very quickly growing industry is made up of children in middle and high school ages. Students who have never smoked a traditional cigarette before are now smoking e-cigarettes. And they contain nicotine. Nicotine is a neurotoxin, which is highly addictive and can cause harm, especially to young brain development. It's illegal to sell in California e-cigarette products to those under 18, but these companies market legally, because they're unregulated by federal law, they market to our youth in flavors like gummy bears and Tutti Frutti and Mountain Dew and root beer. It's clearly designed to hook young children with the sweet taste, and once they're smoking, vaping, they're taking in nicotine. This should be a great concern to everybody. We have spent the past 25 years and over $2 billion here in California trying to get people to be wiser about using tobacco products. All of that is at risk. And this is not by chance. This is well thought out. Wells Fargo has estimated that within the decade, 75% of this industry will be owned by the 3 large tobacco companies. They think they have found their holy grail, a safe delivery system of their toxic, addictive nicotine. That's what it's all about. Big profits for big tobacco. And to the degree that they can sell us all that it is not dangerous like cigarettes, that it's a safe delivery system, and as long as they can keep legislators from defining e-cigarettes as tobacco products, their profits will only grow further. So I just want us to be very clear-minded about what's before us. If all that weren't of concern in and of itself, the Wall Street Journal just last week reported a story regarding a study. The headline says, "Study finds 9th graders who used e-cigarettes are 4 times more likely to smoke traditional cigarettes. So children who have never smoked a traditional cigarette are getting hooked on nicotine, and within 6 months, 31% of them are now smoking traditional cigarettes versus 8% of their colleagues who have never tried e-cigarettes. That is what's happening. It's happening right before our eyes. So I just want to, because you're going to hear from the opposition, and it's an earnest opposition, and they're going to giggle and laugh because they don't believe what I'm saying is sincere, but it is. They're small business people here. You're not going to hear big tobacco. They know better than to come to a committee hearing and show their face. They're small business people. Many of them believe that they are smoke-free, meaning they're no longer using traditional cigarettes, because they now are smoking e-cigarettes. And that is beneficial to them, to their families, that the secondhand emissions are less dangerous than traditional cigarettes because it's being heated, not smoked. This bill will not impact their lives one bit. And I don't know where they get the misinformation that it will. In fact, there are already 178 cities and counties in California which already have local laws on the books, similar to what we're considering here today. That represents almost 19 million Californians. So more than half of the state already has this sort of regulation at the local level because they've exhausted their patience in having the state or the federal government take action. So with the last committee hearing, we heard, again, very earnest people saying that they own vape shops, that they've got 8 employees. They think the sky, according to what they said, the sky will fall. They'll have to fire their employees, close their small businesses, and someone's going to take away their e-cigarettes, and they'll be forced to get their nicotine that they're addicted to back from original traditional cigarettes. That's not conjecture. We came upon a tweet that was put out by NotBlowingSmoke.org, which is a vape advocacy group. And they sent out a message today that says, health, lifestyle, and your business are all at stake. Health. The suggestion is we're going to take away the e-cigarette. They'll be forced to get their nicotine from traditional cigarettes. Not true. Lifestyle. Again, somehow this is going to impact how they live, how they take in their nicotine. Not true. And your business is at stake. And it says to be in Sacramento on Wednesday at 1:30 for the Senate Health hearing. Close your shops and bring your customers or get ready to close down. I don't think it does our conversation any good when such misinformation is put out there. Let's have an honest conversation. This is not going to curtail any businesses. What it will do is by law state that where you cannot smoke a traditional cigarette, you cannot vape. And I don't think that's such a radical notion, because we also have information from another vape advocacy group called Vapor Vision, do's and don'ts for vapors. And one of their don'ts is, don't vape where you cannot smoke. Be courteous. So even advocates for vapors are suggesting that's a good idea. And then with regard, so that's the one big half of the bill. The other half, of course, is to put this under the STAKE Act. And for those not familiar with the Stop Tobacco Access to Kids Enforcement Act, it gives law enforcement additional tools to be able to go undercover and even to use teenagers as decoys in these sting operations to go into retail establishments to catch retailers who are selling to minors. We use the STAKE Act for traditional cigarettes. It has cut illegal sales to minors significantly. We think we can have the same success for those who are illegally selling to minors e-cigarettes. It puts it under the STAKE Act. I can't imagine anyone would disagree with that. And so for all these many reasons, I think this is a very solid bill. It will definitely protect the next generation. For those who are currently using e-cigarettes instead of traditional cigarettes, there's no determined proof that it's safer, but I would encourage more people to smoke them too. just the secondhand emissions, though the California Department of Public Health has said that the emissions consists of at least 10 known chemicals that are listed on Prop 65 cancer-causing drugs. At least it doesn't smell and it doesn't cling to clothing and the environment as traditional cigarettes. So I am in no way opposed to those who need some nicotine and decide to get it through electronic cigarettes rather than traditional cigarettes. This bill will not impact your life one bit. And I hope that people can understand that that's the truth. I am not blowing smoke. So we have a number of folks here, a number of them from the scientific community, so you can hear a bit more from those who know more than I as to why we should, for purposes of public health, support this bill today. Thank you for your time.
Thank you very much. Please state your name and position.
Good afternoon, Mr. Chair. Sawait Seem on behalf of Health Access California. We are the statewide healthcare consumer advocacy coalition committed to quality, affordable healthcare for all Californians, and we are here in strong support of SBX 25. The CDC has shown that nationally, the usage of e-cigarettes amongst young people has tripled in just 1 year. We've gone from 600,000 high school students using e-cigarettes in 2013 to 2 million. These numbers are just very staggering. Yesterday, a study funded by the National Institute of Health found that students who use e-cigarettes are much more likely to try regular cigarettes. The study focused on 9th graders at 10 public high schools in Los Angeles. As Senator Leno stated earlier, students who use e-cigarettes are 4 times as likely to smoke traditional cigarettes. We're looking at an entire generation lured into a lifetime of tobacco addiction using new technology, but really the same old tricks. Sleek ads use much of the same imagery that tobacco companies employed 50 years ago. E-cigarettes have been described as training wheels for cigarettes. Flavors such as gummy worms, Captain Crunch, and bubble gum are designed specifically to appeal to children. Comprehensive tobacco control strategies in California have saved more than 1 million lives and more than $1.34 billion in the last 25 years. This new pathway to tobacco addiction really threatens to undermine the great progress that we have made here in California to tackle tobacco use. The explosion in the popularity of e-cigarettes among the youth should be a flashing red light to us that we are facing a very serious problem. Not only will this bill ensure that youth avoid a lifetime of addiction, but it does so in the most economical way by treating e-cigarettes as tobacco products. Given that the tobacco companies have embraced e-cigarettes and control an increasing share of the marketplace, it really is critical that we treat e-cigarettes as what they are, traditional tobacco. Thank you.
Diane Sipkovich. Good afternoon, Mr. Chair, members of the committee. My name is Diane Sipkovich. I'm a practicing cardiologist and board president of the American Heart Association and longtime volunteer of the American Heart and Stroke Association Western States Division. In my practice, I see patients with coronary disease, high blood pressure, diabetes. You're all aware of the risks of smoking and how it is the #1 modifiable risk factor for heart disease and stroke and the leading cause of preventable death in California and the nation. I've been fighting the good fight to prevent this in my career and have been largely successful. But what we also have to think about is what constitutes a cigarette. Of course, we have the carcinogens associated with smoke, but the nicotine is what's addictive. The nicotine is what constricts the blood vessels. The nicotine is what raises the blood sugars and it's what raises the blood pressure. It's what stresses out the heart. And I'm not even talking about, since I'm a cardiologist, I'm not even talking about what it does to the brain and the difficulties there and the constant stimulation and depression that follows when you try to quit. And in fact, the average nicotine user, it takes 7 tries to try to quit. So we don't want to do this to our kids. I'm not going to bore you with the study again. You've heard that it came out in the prestigious journal JAMA about the 9th graders. what I'm seeing in my practice is kids, I'm seeing kids 12, 13, 14, 15 years old with high blood pressure, with high sugars. So these are kids that are our future, and this is a problem that we're facing. So we don't want to do this to our kids. So we are in a unique position here to prevent this. You're in a unique position to prevent this. We were ignorant and failed to react swiftly decades ago when cigarettes came out, and we don't want to look back 20 years from now when we're trying to treat a new wave of heart disease because we did not act on this. I do not want to be here 20 years requesting funds and help to treat these new potential patients. I respectfully ask that you support this bill. Thank you for your attention.
We've got about a minute and 20 seconds left.
John Lovell. I'm here on behalf of the California Police Chiefs Association, the California Narcotic Officers Association, and the California College and University Police Chiefs Association. We're all in very strong support of this bill.
Thank you. Anyone else in support?
Hi, Lindsay Freitas here for the American Lung Association in California, proud co-sponsor and strong support.